Closing up some of the most egregious socialist, semi-communist, probably not full communist, we're saving that for New York, but semi-communist programs, and we're closing them up.
In this video, we're going to be going over three different opinions. The first one of Donald Trump's, that we shouldn't be paying for the health care of illegal immigrants. There's obviously Gavin Newsom here who says that we should be, well, the federal taxpayers should be paying for the health care of illegal immigrants. And of course, the wild card, Canada, who's saying we have universal health care that the taxpayers pay for. Immigrants, come on in and get you some. Ladies and gents, welcome back. On your way in, why don't you hit that like button? And if you're new here, my name is Clyde. Welcome to the channel. The subscribe button is just down below. Go on and hit that. Let's get into today's story. Donald Trump is saying, forget it. We're not paying for the health care of illegal immigrants in the country. If they're here illegally, they're not going to get health care. And this is why the government's shut down. The Democrats are basically holding the government hostage and saying, no. When you put that provision in the big, beautiful bill, we want you to get rid of that. No, we want universal health care for illegal immigrants, and we want the federal taxpayer to pay for it, which means we're talking about blue states having this service, and they want the taxpayer from red states to pay for it. This is exactly it. Donald Trump saying, nah, that ain't gonna happen, not on my watch.
But the big problem is they want to give health care to people that should not get health care. They want to give health care to illegal immigrants by the millions. Look at Gavin Newsom, what he's done. He's ruined California. He gives health care to anybody. And I guess they do it for votes. I actually think it's bad politics, but I guess they do it for votes. But
I guess they do it for votes. And it really is a game of getting votes by promising stuff that, in fact, the states won't be paying for. If California does this, they'll be asking for grants from the federal government to pay for it. And of course, this will come from states like Texas and Arizona and Florida and any other red states that are out there that are paying lower taxes that would end up paying that tax bill for these illegal immigrants. Now, Gavin Newsom did come out and say, well, I didn't actually say that. That's not what I was saying. But we all know because we heard it.
Poised to be, if this proposal is supported, the first state in the country to achieve universal access to health coverage. So what does that mean? It means full scope Medi-Cal, including long-term care, IHSS, behavioral health to all low-income Californians, regardless of immigration status. Regardless of their age, regardless of their immigration status. Full implementation will initiate January 2024.
Regardless of your immigration status, and this is an awful thing, to be honest. If you've entered the country illegally, then you can just get benefits. This is absurd. This is absurd on its face, and it's absurd to most people. Now, of course, this was something that was brought up in the big, beautiful bill, and this is what they're trying to reverse, and they're holding the government hostage. Well, they're shutting it down. They're holding it hostage in the fact that they're shutting it down as they move forward in this. Now, J.D. Vance had this to say about these provisions.
So there's always a sleight of hand. The Democrats play tricks with words here, but there are two very specific ways, and you can look at the legislative text, two specific ways in which the Democrats are asking us to give taxpayer-funded health care benefits for illegal aliens. The first of which is, if you're an American citizen and you've been to a hospital in the last 4 or 5 years, you probably notice wait times are especially long, and there's a very good chance that there's a person who's ahead of you in line who is an illegal alien. The reason that is because under the Biden administration, we would pay all of the hospital benefits for illegal aliens if they went to an American hospital. Now, that's bad for American citizens who want to use those services. It's also bad for American taxpayers who don't want to pay for illegal aliens to use those services. So we turned that program off in President Trump's one big beautiful bill. The Democrats want to turn it back on, and that would cost, again, hundreds of billions of dollars. There's a second way they want to pay for health care benefits for illegal aliens. And to get into the weeds a little bit, if you remember, the Biden administration did mass parole. So they took millions of illegal aliens. They would wave the magic wand of amnesty and say, no, these are no longer illegal aliens. they are now parolees because we're not going to deport them. And then they would give those parolees healthcare benefits funded by taxpayers. We turned that off as well, and Democrats want to turn it back on. So it's just a matter of fact. As much as they try to change the words that they use and hide from the reality of the policy, it's a matter of fact that there are two programs that total hundreds of billions of dollars, taxpayer-funded healthcare benefits for illegal aliens. The Trump administration turned it off. Democrats want to turn it back on. And it's not just that we have a policy disagreement here. As crazy as that one is, it's not just they want to turn those benefits for illegal aliens back on. It's that they're willing to say that our troops aren't going to get paid until Donald Trump relents and turns those benefits for illegal aliens back on. It's preposterous. It's bad policy.
And it ain't gonna happen. That's really what it comes down to. It ain't gonna happen. But there might be an incentive to go elsewhere. Now, this is one of those things where this actually encourages people to come into the United States illegally. If they come into the United States illegally, they could get health services. They just jump the border or fly in and then overstay on a visa, and then they can get healthcare services in states like California or New York or things like that. That's not great, but they may have a new place to turn to because, well, the federal government of Canada is now saying they're going to take care of it. That's right. Oh, you can't make this up, folks. This is the IRCC, Immigration, Refugee, and Citizenship Canada government agency, putting this out on Twitter saying, thinking about moving to Canada? Did you know that Canada has public health care? Learn how it works. Who can get it and what services are covered. Get the details and helpful tips. Now, Canada's government is just itching at getting more people to come into the country every single day. Not that we didn't just take in millions and millions of people, but this is what they're trying to do. They're trying to entice people in with this. Now, a lot of people are making comments about this online. We got Cosman here saying in 2018, the Liberals gutted medical immigration admissibility safeguards. There were safeguards in place so that people wouldn't just come here and soak out of the system so that Canadians can't actually get access to these things. But they broke these safeguards down back in 2018. That's right, allowing entry to those with conditions costing 3 times the average Canadian's annual healthcare expenses. Now they're shamelessly peddling our hospitals to the world's 304 million migrants. Liberals loosen the rules that exclude immigrants on medical grounds. That's right. They've loosened it up. And remember that year, 2018. Well, what else happened in 2018? That's right. More than 74,000 Canadians died waiting on healthcare. The wait lists since 2018. A report, at least 15,474 Canadians died in 2023 to 2024 alone before receiving various surgeries or diagnostic scans. The true number is likely to double, especially when they bring in this many new people to get these services. Tracy Wilson saying, they hate us. They hate us. This is exactly what's happening here. But back on the other side of the border, the news is talking about this. This is from Representative Wesley Hunt, his press office, posting this bit from Fox News. Reality check: in California for the last 2 years, Governor Newsom spent $22 billion on healthcare for illegal immigrants and ran to President Trump asking for a bailout. Americans cannot afford to pay for illegal immigrant healthcare, period. This can't happen. No way.
I'm out here in California, and Gavin Newsom for the last 2 years spent $22 billion on health care for illegal immigrants, and then had to go to the federal government for a $4 billion bailout because actually we cannot afford to give illegal immigrants health care. So it ends up being on the back of the American citizen and costing the tax-paying American citizen their health care and their benefits. So the federal government will not have the same bailout, and that's a non-negotiable issue for the American people.
Major economic consequences as a result, and the longer this goes on, the bigger hit we see to the economy. We're going to be talking to our good friend Austin Goolsbee about that.
Yes, bigger hit to the economy. Donald Trump says, no, we're not going to do this. And in fact, we're going to get rid of a lot more of the stuff that the Democrats have brought on, and they're going to go away for good.
That are Democrat programs that we wanted to close up or that we never wanted to happen, and now we're closing them up. And we're not going to let them come back. The Democrats are getting killed. And we're going to have a list of them on Friday, closing up some of the most egregious, socialist, semi-communist, probably not full communist, we're saving that for New York, but semi-communist programs, and we're closing them up. We're not closing up Republican programs because we think they work. So the Democrats are getting killed, but they're not telling the people about that. I say it, nobody, well, I haven't said it probably as bluntly as I just said it, but so we are closing up Democrat programs that we think that we disagree with, and they're never going to open again. Thank you very much. Thank you, everybody.
Thank you very much, Mr. President. I'd love to hear what you guys have to say about this on all grounds. Do you think illegal immigrants should be getting health care services in the United States or in Canada? Do you think Canada is pulling the right move by saying, bring everybody in? We've got health care. Go get your sick people and bring them into the country. Let me know in the comment section down below, and we'll see you in the next one. Keep on trucking.